Good day, everyone. We are the Group 1, and we are here to present our case report. A 23-year-old male suffered from a minor laceration in his left arm. Left untreated, the wound failed to heal, eventually producing a yellowish discharge, as seen in the photo. Soon after, he developed a high-grade fever. He was treated with an oral antibiotics. And here's the guide questions. First,
is this acute or chronic inflammation? This is a case of chronic inflammation. Acute inflammation is a short-term response to injury or infection. It is characterized by the following signs and symptoms like redness, swelling, heat, pain, and loss of function. On the other hand, chronic inflammation is a long-term response to injury or infection. It is characterized by the following signs and symptoms like prolonged inflammation, tissue damage, and fibrosis or scarring. In this case, the laceration on the man's left arm failed to heal and produce a yellowish discharge. This suggests that the inflammation was chronic. Additionally, the man developed a high-grade fever, which is another sign of chronic inflammation.
Processes involved in the development of lesion and clinical signs. The development of the lesion and clinical signs in this case can be explained by the following processes. 1. Injury. The minor laceration on the man's left arm caused damage to the skin and underlying tissues. 2. Inflammation. The body's immune system responded to the injury by sending white blood cells to the area. The white blood cells fought off any infection and began to repair the damaged tissues. However, in this case, the inflammation did not resolve completely and became chronic. Chronic inflammation. Chronic inflammation is characterized by the prolonged presence of white blood cells and the other inflammatory cells at the site of injury. This can lead to tissue damage and fibrosis. 4. Yellowish discharge. The yellowish discharge from the laceration was likely due to the presence of pus. Pus is a collection of white blood cells, dead cells, and bacteria. 5. Fever. Fever is a common sign of infection or inflammation. The fever in this case was likely due to chronic inflammation in the man's arm.
Mediators and their specific function. The following inflammatory mediators are likely involved in the development of the lesion and clinical signs in this case. Histamine. Histamine is a chemical that is released by mast cells in response to injury. It causes dilation of blood cells and increased blood flow to the area of injury. This leads to redness and swelling. Prostaglandins. Prostaglandins are a group of chemicals that are produced by a variety of cells in the body. They have a variety of effects, including causing inflammation, pain, and fever. Cytokines. Cytokines are small proteins that are produced by immune cells. They play a role in cell communication and regulation of the immune response. Cytokines are involved in all phases of inflammation, including the initiation, propagation, and resolution of the inflammation.
Identification and description of the inflammation present. The inflammation present in this case is chronic inflammation. Chronic inflammation is characterized by the following: prolonged inflammation, tissue damage, and fibrosis. Differences between chronic inflammation and other patterns of inflammation. The main difference between chronic inflammation and other patterns of inflammation is the duration of inflammatory response. Acute inflammation is a short-term response to injury or infection. Chronic inflammation is a long-term response to injury or infection. Another difference between chronic inflammation and other patterns of inflammation is the type of cells that are involved. Acute inflammation is characterized by the influx of neutrophils, which are a type of white blood cell that is a good fighting infection. Chronic inflammation is characterized by the presence of macrophages and lymphocytes, which are the other type of white blood cells that are involved in a long-term inflammation.
The following microscopic findings can be expected during the process of healing or repair. In this case, first is neutrophils. Neutrophils will be present in the early stages of healing to fight off an infection. Second, macrophages. Macrophages will be present in the later stage of healing to help repair the damaged tissues. Third is lymphocyte. Lymphocyte will also be present in the later stages of healing to help regulate the immune response and prevent the inflammation from becoming chronic again. Fourth is fibroblasts. Fibroblasts are cells that produce collagen, which is the main component of scar tissue. Fibroblasts will be present in the later stages of healing to help repair the damaged tissues. In addition to these cells, the following microscopic findings can also be expected during the process of healing or repair. First is a new blood vessel. New blood vessel will form in the area of injury to provide the healing tissues with oxygen and nutrients. Second, granulation tissue. Granulation tissue is a type of tissue that is rich in blood vessels and inflammatory cells. Granulation tissue will form in the area of injury to help repair the damaged tissues. And lastly, scar tissues.
Thank you, and that's all.